Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting here at Neck of the Woods Brewing Company in Pittman, New Jersey, enjoying a nice cold sour beer with my good friend Dr. Frey, and we have a special guest on the phone tonight. Dr. Frey, how you doing?
Spectacular.
Tonight we have Dr. Ethan Kreiswirth on the line, calling in from California. Dr. Kreiswirth, how you doing?
I'm doing great, man. Sunny California today. Been having tons of rain, but we're not used to that. But it's beautiful.
The irony is that it was actually sunny out here in February in South Jersey. It was like 60 degrees a night. It started raining later, but like how often does that happen?
Yeah, it doesn't happen as often as we out there. It sure doesn't. Ethan, your company, I guess you could say, reach out, and your assistant reach out to us because you are the owner of Black Belt Sports Medicine, and you oversee medical services for the International Brazilian Jiu Jitsu Federation. And I think I got super excited when I saw the DM come through on our Instagram page from your page, and I was like, whoa, this is completely way different. This is like a topic of interest to me. I'm a huge fan of MMA. My brother is an active practitioner of Brazilian Jiu Jitsu, so I kind of have some familiarity with it. But I don't have much familiarity of the medical side of it, other than like the athletic side of it, which is kind of interesting.
Really cool.
So I wanted to thank you for reaching out to us, and by all means, tell us a little bit about yourself and kind of how you got involved in Black Belt Sports Medicine.
Yeah, that's great. Thanks. I appreciate it. So I've been involved in jiu-jitsu as a jiu-jitsu athlete for about maybe 28 years. I'm also a certified athletic trainer from 1995, I think was when I sat for the exam. So I'm old, right? So been around a long time. And luckily it just kind of matched up. I mean, jiu-jitsu, the sport of Brazilian jiu-jitsu that came from Brazil, it was modified from Japanese jiu-jitsu to this really crazy art of a chess game on the ground, of rolling around with the kimono on and tapping each other out with these terminal ankle, heel, foot, everything locks and chokes. It came to California, specifically came to Los Angeles with the Gracie family. And
with the Gracie family.
The Gracie family. So I trained with Hoist and Horian. So the first Ultimate Fighter was Hoist Gracie, right?
I mean, that's who introduced all of us to it, like way back when. Yeah.
Way back when. I mean, I was training with him after I watched the second or third Ultimate Fighter. And it was called the Ultimate Fighter back then.
Right.
Yeah. So it was basically Hoist against the world. It was a tournament, right? So Hoist had to continue to fight all these guys coming at him with no time limits, no holds barred. I mean, they were doing groin shots, fish hooks. It was on, no gloves. It was just meatheads fighting other meatheads. And I was a high school wrestler, and I'm like, this looks great. And guess what? Hoist Gracie is basically opening up a dojo down the street. So it kind of fell into my lap that I got involved in jiu-jitsu maybe like in 91 or 92. And it was small time then. And the only way they promoted it was putting the weakest brother of the 6 brothers out there to fight all these other guys. And, guys would come into the dojo and want to challenge Hoist, and Hoist would say, if you could beat my brown belt, then, you can fight me. And they would have fights in the dojo. They were called Gracie in Action videotapes. And there were three series of Gracie in Action. Those are way back when. Then it got popularized, right? So the International Brazilian Jiu-Jitsu Federation, which puts on Brazilian Jiu-Jitsu tournaments, is kind of like the Cadillac tournament in Brazil. And they said, we're going to bring it to United States. And they did so. And they did so, again, into Southern California. And I was a blue belt by then, and I said, hey, I reached out to them. I said, I'd love to compete at your tournaments, and I'll provide you medical care. And they had no clue what medical care was. So I said, well, what's going to happen is I'm going to compete at how many fights I get. And then when I'm done with my fights, I'm going to sit mat side with a cooler and a bunch of tape and a table, and I'll sit here all day for you, and I'll run out on the mat and take care of injuries. And they're like, cool. And they would just pay me at the end of the day cash from the door, and it was crazy. I mean, it was like just mayhem. It was like a wrestling tournament on steroids with no rules. You know?
Yeah. So at that point, did they have any like MDs or DOs or you were there and you're going to take care of it and you're going to fight when you can fight and you can take care of it.
It was basically me marketing myself. So I was the head athletic trainer at this college that they wanted to have events at. So everything again fell in line. I'm like, hey, you're going to have an event here. I'm going to sign up and compete. And then And they said, well, what are you? I said, I'm a certified athletic trainer. They're like, what is that? I mean, no one spoke any English. I mean, English was very broken.
Yeah.
I just said, I'm going to do this,
Yeah.
and I'll be here for you. So,
did anybody ask the question, what happens if you get hurt?
yeah, right. Well, luckily I know the sport, so I didn't get hurt too much. But yeah,
Smart.
it was, it started out with about 6 mats for one day. And then, the tournaments now, we cover tournaments up to, 47 to 50 mats over a 4 to 5 day period.
That's unbelievable.
That's
seriously.
crazy.
It's just unbelievable. Yeah, it's got crazy. And there's, tournaments every weekend that we cover, that are nationwide,
Yeah, and I think it's interesting, too, because even here in Pittman at the Total Turf Experience facility, they do host a jiu-jitsu tournament locally, and I think it happens like once a year. I think it's in the wintertime. And like I mentioned before, my brother, he's a purple belt as well, and he competed in a couple different tournaments, and I'm his Brazilian Jiu Jitsu athletic trainer, to say the least. But I have not covered any matches myself. But I think it's interesting, like you said, like it just kind of fell into your lap, perfect place, perfect timing.
Right.
And you kind of rolled with it, pun intended.
Yeah.
And now you're here. And I think it's crazy that like so much time and like, I don't know, it's just, you can't beat good timing sometimes.
Yeah.
No, I definitely jumped on it. And, there's been so many medical professionals that try to jump on it to market themselves, especially chiropractors.
Sure.
I want to be a part of it. I want to be a part of it. And I said, I really love to hire athletic trainers because I like to give back.
Right.
And, athletic trainers are ready for the full day. Chiropractors, PTs, MDs, they're not ready for that 12-hour day, which athletic trainers truly know.
Sure.
Right. Yeah,
Right,
absolutely.
Yeah.
Actually, I have a buddy out there. He is an MD, Eric Stark, and I know he was doing some of the competing himself. But the truth is, I'm not sure where the line falls between MMA and Brazilian Jiu Jitsu. And I hate to say it, it's kind of a little bit of an admission for me. When I think Brazilian Jiu Jitsu, the only way I think about it is what I've seen in MMA and, like you're saying, like the Ultimate Fighter and whatnot. Is there actually a difference in the tournaments, the Brazilian Jiu Jitsu tournaments, versus like an MMA tournament that's maybe it's not sanctioned by MMA, but like you're
Yeah, no, it's huge. It's huge. So MMA, the term MMA mixed martial arts came after Hoy started fighting, kung fu, boxing, hapkido, taekwondo, everything. And then those fighters basically had to learn jiu-jitsu and Hoy's had to learn some of their stand-up game, hence the word mixed martial arts.
Right.
So MMA is all-encompassing kicking, punching, as well as wrestling and jiu-jitsu. So it's all-encompassing. Jiu-jitsu, Brazilian Jiu-Jitsu is just a wrestling game with submission locks. That's it.
Right.
So there's no punching or kicking.
There's no punching or kicking. Yeah.
No.
Right.
But the sport is evolving. There is now tournaments, not IBJJF tournaments, but there's now tournaments where slapping is legal.
Slapping.
Oh, wow.
Okay.
Yeah, they're doing slap games, like slap jiu-jitsu games, really disrespectful stuff.
I could see that.
I think I'd rather be punched than slapped. You know what I mean?
Yeah, absolutely.
The game is evolving into these single fights. Not so much tournament style, single fights for money, slapping, all kinds of different types of techniques now.
Yeah, and I think it's even, like you said, like the jiu-jitsu grappling aspect of it is kind of like gaining a little bit of popularity. And I think, a couple years ago, I think John Jones was in this like grapple-only tournament, and it was kind of broadcasted online and other different things, and different UFC fighters are kind of doing that. And I think they're trying to bring light to it and I think just highlight the sport a little bit outside of like the UFC, the Bellators.
Exactly what we think about, right? The MMA.
Yeah, and I think that's really important.
When I did my dissertation, I wrote it on the epidemiology of Brazilian Jiu-Jitsu sport injuries, and at that time, that was 2012 that I wrote that paper, and the online interest was like 106%. So every year, the interest in MMA and Jiu-Jitsu. It's like Fight Club. It's crazy.
Right. Yeah.
In LA, you have a liquor store, a tanning bed, and a jiu-jitsu dojo. On every corner.
Right.
It's crazy.
Yeah, and I think with that being said, and I think with the popularity of the UFC being like the kind of the paramount or the key mark of like the fighting promotions that are out there now. The Premier League of it. Yeah. They've changed the game, and like even out here, it's just like for when I grew up. it was, you saw the more karate and like all the taekwondo stuff. Now you see jiu-jitsu, like you said, dojos everywhere.
Right.
And
Everywhere.
different places. And, my brother, he has, his gym has 2 different locations in the South Jersey area and different things. It's crazy how it's evolved, and like you kind of evolved with it, I guess it's fair to say. And that, like, what was it like, I guess, kind of just going right into my next question, what was it like in the early days, kind of as an athletic trainer, being the medical professional and like also an athlete at that too? Like, what were the biggest like barriers and struggles that you had like in the beginning, kind of like putting your foot down, being the medical professional outside of like the Brazilian Jiu Jitsu athlete?
Yeah, I mean, just like any athletic trainer, you have to prove yourself to a coach or an athlete. You need to walk the walk, talk the talk. So being a black belt in the sport, as I evolved with the sport, that truly helped. Knowing mechanisms of injury truly helped.
Very insightful.
But
yeah.
I mean, I would have, people would jump over the railing and come out onto the mat, which is a parent or a coach.
Oh, no.
And,
Oh, yeah.
it's just your typical stuff. And over the years, they keep on seeing my face, and then I'd hire people, and I got shirts and try to look more legitimate. And it took some time for sure. I still have guys trying to tell me what to do. And I've been around for a long time. I'll have a doc who says he's a doc, and he wants to take care of it. I'm like, hey, if you want to take care of it outside the gym. If it's inside the gym, it's mine. So. You have that kind of chest thumping stuff because this is jiu-jitsu, so everyone's a type A personality, especially when the fight's going on. So, and I've had a couple instances where, being on the mat, I've choked a couple guys out unconscious, and then I have to treat right there. You know what I mean? So it goes both ways.
Oh, man. That's got to be very
wild.
Interesting. That's very interesting. It's funny. In that aspect, as when I was in grad school, I covered club sports, and I played lacrosse growing up, and club lacrosse was one of my sports I had to cover. So I did the very similar thing where I played, but then when someone got hurt, I threw my helmet and my gloves off, and I went to take care of them. And then
that's right.
And I had like
change the hat.
Yeah, you just change the hat, and I had a classmate come cover the game, literally just for my own safety. I said, "Your only responsibility is me. Everybody else, I'll take care of. I'll just throw my helmet off. But other than that, if I go down, please come out there and save me because I'm gonna."
I love it. I love it.
So that's kind of interesting. That's kind of how it worked out. So how long has black belt sports medicine been around? Did you kind of start that like right away, or did that kind of just?
No. Yeah, so I was the head athletic trainer for that university where they had a big gym, and the events would come. And then, the events were only maybe like twice a year.
Right.
Then the events started getting, quarterly. Then the events started getting monthly. And then I said, I need to get a handle on this if I'm going to really do it. So I created an LLC, and then I started just sussing out and reaching out, through social media, through phone calls. So if they would have a tournament in New Jersey, it never got there. The only thing that got so far across the states is because COVID happened. And when COVID happened, we couldn't host all the tournaments in California.
Right.
But we could host them in the southern states, Florida was a hotbed during
interesting.
COVID. Yeah.
That makes sense.
One of the few advantages to COVID.
Yeah.
Yeah, it really spread out after that. And I had to hire an assistant and said, hey, we need to make cold calls to all these colleges and see if we can find athletic trainers. And then an athletic trainer would say, well, I don't even know the sport. So I do Zoom calls with them and try to go through all the technical ideas of what they're looking at. It's similar to wrestling, but there is some other stuff to know. So yeah, it just started evolving like that really fast. And before I knew it, I had to start, organizing myself. And I'm not great at that.
All of a sudden, regulation becomes like a factor in my mind. Early on, you were doing the competitions, and it was like, hey man, this is what we got, and I can take care of it. I know the sport, I know what I'm doing, and I can take care of these injuries. But so my first question is in California, are there any regulations that would prevent you from being able to do some of the things you want to do? And then the follow-up question to that would be, what about when it does spread out to other states? Or do you run into any issues there with who you need to have at the different events to cover the events?
Yeah, those are great questions, and there's some really great areas there.
Yeah.
California is the last state that has no practice act in athletic training.
Wow.
So we are kind of like a jack of all trades out here, master of none, floating around.
Can you explain what that means then for someone who wants to do athletic training and for athletic trainers who are doing athletic training and other people kind of jumping in?
Well, I see it as two things. It allows me the freedom to learn how to suture.
Right.
You know, and
Huge,
practice suturing.
especially in this environment.
Yeah. And, you know, I mean, athletic trainers who take dry needling courses don't practice dry needling in California, you know,
Right.
so
Right.
there's a, you know, we want to be regulated because then we can, you know, we can bill potentially and do those other things. But then again, personally, as a LLC owner, business owner, I don't want to be regulated because I want to be able to do things I want to practice and do and help.
For sure.
You know, but there is that really gray area. Now, we fall underneath the IBJJF. So when they travel, we travel, and we're underneath them. I do reach out
big, right?
to MDs and to athletic trainers, but sometimes we just don't have it, and they want the coverage. So we send people that have licensure in that state. So we do fly people around, but we really hope to have athletic trainers. So if there was an event in New Jersey, I'm hoping to hire an athletic trainer who's licensed by New Jersey to cover that event.
Somebody local who can take care of it right there. Yeah.
We're hoping, but there's been plenty of times when, you know, we don't have that ability. I mean, the athletic trainers are extremely busy during school years.
Right.
During the summer, everybody wants to work for black belt. But when double day starts, no one's around.
Yeah, absolutely.
Crickets. Yeah, left and right.
So, but Doc, there's some really great areas there. You know, we run into that one all the time. And, you know, I get MDs that say, I want to work for you, but I'm just going to be an observer because I don't have licensure to practice in that state.
Yeah.
So, you know, so that's what it comes down to. It comes down to the non-scope of practice and the lack of state practice acts in California.
Right. And I don't think people generally would think of that as an actual concern, but that's like, it's actually a legit issue. Like there are rules being changed, the laws being changed in Congress, like even on like NFL level, like traveling, like docs traveling with their teams, and but they're not licensed in that state where they go, and so it's like something the average person would ever think about, but like once you get into the weeds, there are some technical challenges there, and especially like in the business model that you have set up. I think it's brilliant. It's awesome, right? Like to have that and to supply those services. We had talked about that on a much smaller scale here, just athletic trainers for any events that needed coverage that didn't have coverage, but like that's a fantastic. And I think, like you said, you have the advantage of having the International Brazilian Jiu Jitsu Federation sort of being under their umbrella. That's right. That's the key. That works out fantastically.
That's right. We've even had black belt athletic training contractors go out to Rome, Italy. So if we have a chance to do international, because IBJJF is the biggest tournament style jiu-jitsu around still. I mean, there's a lot of federations out there, right? But they're still the biggest, and people want to compete for them. So
that makes sense. So you kind of touched on a little bit earlier about suturing, and I know it was like mat side suturing is kind of like one of those things that are like, that you do kind of often, and it's kind of so for me as an athletic trainer in New Jersey, we're not allowed to suture. It's out of our practice act, and I've spoken to a few people since I talked to you last night or whatever, and people who know our state practice act way better than I do, and I talked about it, and it seems like it's on the horizon. It's coming, but it's not here yet. Right. I talked to my boss today, and she was saying like, yeah, I think it's something that that's been pushed for a while. It hasn't gotten passed yet, but it's like within the next 5 to 10 years, it's probably coming down the pipeline for athletic trainers to do some suturing, which makes sense.
Yeah.
I mean, like we see
it.
Absolutely.
We see it so often. And, like I kind of mentioned to you before is that in previous work settings, I ordered suture kits, but they weren't for me. They were for my docs if I ever needed them to have it there.
Right.
But it'd be one hell of a change of pace for me to be doing it, and it saves a lot of time. It saves a little bit of headache. It saves like an athlete a trip to the ER or urgent care or something along those lines.
Huge. Yeah, no, I mean, again, just like Doc was saying, these are gray areas.
Right.
But the reason why I started learning how to suture is because I really wanted to help the athlete.
Right.
Of all the things that you just said, all those things.
Yeah.
And they're so thankful. And I do a consent release. Would that hold up? I don't know. I still do a consent release. Mm-hmm. I work underneath the medical physician. And typically for the big events, like we just had the World's Master at Vegas, you're talking, 10,000 athletes.
Yeah.
I probably sutured about, I don't know, five people over those 4 days.
I would have expected that to be an even bigger number.
Yeah. Well, that was a gi tournament. When it's no gi, because we have no gi tournaments, right?
Yeah.
Just rash guard and board shorts.
Yeah.
those numbers can climb because it's so sweaty. There's so much fast, violent movement, a lot of headbutts. Yeah. So
that makes sense.
So this weekend we have a very big tournament in Los Angeles, and there's gi on Saturday and no gi on Sunday. There'll be more lax.
Okay, so
I'm looking forward to it, guys.
Extra.
I'm looking forward to it.
I bet. Right.
And you pack a couple extra suture kits for that Sunday, right? Like you just have it ready because you know it's going to be
lidocaine, suture kits, different silks. It depends on where the lac is, but most of my lacs are facial lacs. Those are pretty easy to do. Some of the body lacs, the skin's a lot tougher. So practicing with suture kits, practice kits just isn't really. I mean, Doc knows it's just not the same.
Yeah.
But it's good practice. But typically the big tournaments, I have an oversight physician who supplies me with lidocaine, and I'll shoot lidocaine with him there, and I'll suture just simple interrupted. He's shown me, with that doctor, I've done a lot of practice with him and gone over competencies with him so I can feel. Because the biggest jump, you guys, is going from suture kit to human.
Yeah.
Because suture kits don't bleed.
Right. Right. Makes it a little harder.
Yeah, that makes a lot of sense.
So stitching with a gaping wound and a lot of blood and a person who's moaning and groaning is a lot different, So
and moving around and whatnot. Are you betadining and throwing like a little whole sheet, a little drape over the top of it, or you just letting fly right there and then?
No, I'll drape if I have it. So facial lacs, I'll drape, and I'm not going to suture mat side because everybody in their phone is out. Right. And you've seen some of the videos already. So I'll take them to a back area with the extra table, and I'll take an assistant with me just to, cut the silk and also to dab. They're all gloved up and everything, but they won't suture. But just to handle instruments and stuff.
Yeah.
But it's been great, and I can't tell you how thankful these guys are that they didn't have to spend the money. They're from out of town, from out of the country too.
Right.
Some are from out of the country. They're not going to get. They have no health insurance. They're not going to get any.
Right.
So it's almost like being rural. So if they're rural and you have no option, then help them out.
They're just appreciative. Yeah, for sure.
Very.
Thank God I have someone here doing this for me. The back in med school, I remember one of the practice mediums was pig's feet. Like they would order, we'd have like a jar of pig's feet, and everyone would get a jar and slice open like basically the skin on the pig's feet, and then you would sew that back together.
Makes sense.
Yep.
Yeah. So you kind of touch on it, like these tournaments are, worldwide athletes. They kind of come from all over. So from your standpoint, what do you see as like? Do you have a lot of instances where you run into like language barriers and things like that? And I just assumption, like being that it's Brazilian Jiu Jitsu, are you like somewhat like you pick up Portuguese along the way, or is it like you just kind of like figure it out?
No, I mean, I've been around jiu-jitsu for a long time, and my first tournament was 98, I believe.
Okay.
And it was basically real Brazilians coming over to compete because the IBJJF came here, so there was no English. So what I call it mat side Portuguese,
Right.
Yeah. Was it door? Was it pain? I forget. Yeah. And then
where's the pain? Do you need ice?
Right.
How can I help you? What's your name? I can get by, but don't have a conversation with me because then I'll just be like, what? I spent some time competing over in Brazil too. I spent about a month in Brazil just trying to learn the language and just being involved in the community. So
okay, that's really cool.
That's really cool.
Yeah.
Right.
Yeah.
What do you think of some of the more common? We spent a little time talking about the lax and suturing and whatnot. What do you think of some of the more common injuries that you wind up seeing within these tournaments?
Yeah, I mean, my research suggests that elbow injuries were number one at a blue belt level. So we get a lot of elbow joint sprains, if not dislocations, because that's a very long lever to attack.
Right.
That makes sense.
Arm locks. So knee locks had a higher probability of risk of injury too, because it's a long lever, but you only could be a very high level belt to attack a knee. A brown and black belt could only attack a knee. Now the game is getting so twisted and convoluted. I'm seeing a lot of posterolateral corner injuries.
Oh, wow.
Knee. Yeah.
That's
because
incredibly specific, but I can see.
Yeah, so you're looking at arcuate ligament, of course, PCL, LCL, the whole posterolateral complex.
Right.
And that gets stretched out because of the way we're putting ourselves in positions for long periods of time. So it's almost like a slow load over a long period of time will kind of cause that tissue creep.
Right.
So we'll get, if somebody injures their knee, they'll come to me and I'll do ACL, PCL, and collateral testing, and then I'll say, man, this lateral corner, post-lateral corner is a mess, But then I ask them, do you play what we call de la Hiva, which is this various external hip external rotation and tibial knee flexion internal rotation. So they like weave their leg through and they sit in that position and it kind of stretches out the PCL or the post-lateral corner a lot. And I see a lot of these now.
Wow.
So
that's different. That's not
the
what
acute injuries.
Yeah.
The acute injuries, we're still looking at inferior shoulder dislocations. That's a common one.
Inferior.
Yeah, I've had a couple of mandibular dislocations that I've tried to reduce.
Holy
I've been
crud.
successful with those. Yeah, just from tucking your chin while you're choking somebody.
Right.
Yeah, so your mandibular will, those odontoids will kind of pop out into the cheek area. So
Yeah.
I'll just do like an anterior drawer on that, and it'll kind of suck back in if I get to it real quick.
How about that,
Yeah.
man? And I take it you're trying to reduce the shoulders right there, Matt's side.
I tried it so before any onset of muscle spasm, if I get to it,
it's easier to get it
I'm
early.
putting that thing back in.
Yeah.
It'll go back in really easy. I mean, just by capsular suction alone.
Right.
I was just having a conversation about that exact scenario. One of my friends, we just spent we didn't do a show last Tuesday. We were just out in Colorado skiing, and one of my friends that we were out there with, she during her fellowship, she's a neurodoc, and during her fellowship, she would she was out in Oregon, and she would work with ski patrol out there and whatnot. And they were talking about her and her husband how same exact thing where people dislocate their shoulders and they just try to pop them back in whenever they can, either right there on the mountain or when they get down to the bottom of the mountain before the exact same reason, before everything tightens up, before it spasms, and you stand a much better chance of getting it back in rather than waiting. They had their whole little system on the way that they did it, and pretty high success rate. And so I think there's a lot to that. Get to it quickly and try to get it in quickly, because once everything does start to tighten and spasm, next thing you know, they need sedation and whatnot. It's a whole different ballgame.
Yeah, I totally agree. I mean, these these Fuchs injuries, posterior elbow dislocations, shoulder dislocations, or it could be from an actual submission move,
Right.
But if you get to it quickly and you don't feel any crepitus, I always tell the athletic trainers, if you feel crepitus, and sometimes you do, then leave it alone. Yeah. If you don't feel any crepitus,
get the X-ray first.
Then you can really go for it.
But
here's the thing about joint reduction. And what I've seen over the years of athletic trainers who I've hired is they don't want to go for it. You truly, as you know, Doc, you truly have to go for it.
Yeah,
right.
All in.
You really got to yank on those joints. Yeah. And I feel like static holds will just kind of turn off the nervous system reciprocally, and the joint will go back in.
Right.
As I was gonna say, I kind of go slow and gradual, but it has to be legit effort.
Right.
You can't.
Slow, gradual, steady the whole time. It has to be sustained.
Yeah.
That's at least for my expertise.
For sure.
Right.
Agreed.
Yeah. No, I've always kind of taken that approach. Like, you got to give it really one good shot. If you start struggling, then I don't feel comfortable. Keep attacking.
And if you go half-hearted attempt, it's not going to
No,
work.
you got to give it one good shot, and then usually and most of the time it works. But then if it doesn't, then you're like, all right, let's not keep poking the bear a little bit. Let's get this thing taken care of.
Man, I've hung on some joints for 3 to 4 minutes.
Yeah.
It's sustained. I'm sweating. I'm hanging on that thing.
It's tiring.
Like a kettlebell.
It's tiring.
It does not feel great when you're just holding on there. Like, I definitely.
But when it goes back in, everyone's like,
yeah, celebration.
You're the hero, right? You're Superman.
Yeah, you're the hero.
Absolutely.
Right.
So I think it's crazy, like I kind of mentioned to you yesterday, I do work at a university where we do have an athletic training education program. And I love it that I do this podcast and I get to meet different individuals, different athletic trainers from across the globe and different specialties. And I brought it up, the questions to the students this week. And I was like, hey, look, I'm interviewing someone who's in charge of the medical coverage for international Brazilian Jiu Jitsu tournaments. What do you guys have questions about? And I had a couple questions I just want to throw your way. And I think the biggest one was like comparing them to, as an athletic trainer, to like a wrestling match with like blood timeouts and skin checks and other things like that. So what's your involvement in that, and kind of how does that work when, are there blood timeouts and other things like that in tournaments that you work?
Yeah. So the research suggests that the number one injury in NCAA wrestling is defense of a takedown. You'll get it at the knee, and also shoulder injuries have a higher risk.
Right.
And in jiu-jitsu, we don't have a lot of takedowns going on. We pull guard. We actually sit down on the mat half the time.
Right.
So we don't have as many TBIs or cervical or defense knee injuries. What we do have is more related to the terminal submission lock, like
Right.
the ankle being plantar flexed and inverted, and all those lateral ligaments being blown out because that's where
Oh.
they took their ankle,
Right.
you know. Or we do have knee dislocations because somebody hyperextended their knee, and that's a jiu-jitsu lock. They didn't tap in time.
Right.
Yeah,
They
yeah,
didn't tap
yeah.
in time.
Pride,
So
pride.
you have to
I get
tap.
it. Yeah.
So if you don't tap, your joint will dislocate, or you'll get a bone fracture, or have something, you know, pretty gnarly happen.
Mm-hmm.
As far as bleeds, so NCAA bleeds, you have a short amount of time to control bleeds.
Right.
In jiu-jitsu, we have what we call 2 blood stops,
Mm-hmm.
and the third blood stop that a referee calls you out for is a DQ.
Okay.
So I don't have any time limits, but the referee kind of like, he's pushing you a little bit.
Okay.
But if I can control that right there with just gauze and wrap around the head, or maybe I have some type of, you know, quicksand or anything I'm going to use at that time, I'll use it right away, get that blood stop, especially if it's high level. If you're looking at a high level black belt fight that everyone's fighting and it's all over Flow Grappling and international television, which is live, I'll try to control bleeding as quickly as possible, no matter what it takes. I've wrapped people from the chin, around the head, around the nose. I've mummified them because I don't want them to fight.
Right.
Yeah, it looks really stupid, and you would think, God, is that going to compromise his airway? These guys don't care. I've compromised airways in the nose, and there's mouth breathers, and they've completed the fight, and then we've gotten suits.
They just want to get back out. Yeah.
That's it. So,
is there almost a like a little bit of a pause before the person who has the lock, you know, kind of goes full bore, giving that person a chance to tap for just a second? Or is it just a full-on, like, you go and you get to it, and that person has the responsibility to know that it's coming, and you better tap before he fully, engages?
there's it's really disrespectful to really hyperextend a joint with speed and velocity.
Yeah.
It's disrespectful to sport, but when it comes to competition,
Right.
it is on.
Right.
And you know what? You better know that it's coming.
Yeah.
Yeah.
Now, I feel it's disrespectful. You should get to that joint and be able to control it, squeeze it, hyperextend it if that's the lock, or rotate it if that's the lock, and then let the guy tap.
Yeah.
But the high level of jiu-jitsu now, these guys are so good. They're within fractions of each other as far as technique and success.
Right.
So if they get it, they're going for it.
Because if you pause, maybe you don't get the submission. Maybe it gives them just enough time to get out of it, kind of a thing.
Well, a lot of times they can't tap, so they're yell. It's called a verbal tap.
Right.
Yelling is a verbal tap. So we've had that before.
Mm-hmm.
The super technical high level jiu-jitsu fighters would never slam a joint. I call it. They would never speed and velocity a hyperextension.
Yeah.
The lower belts, the white belts and the blue belts, they may not even know very well. They're so pumped up with adrenaline, they just are slamming joints.
Yeah,
that's when we get our injuries.
Yeah, right.
And that's what the research says. The research says blue belts have the highest level of injury and a 3-time risk factor over their other belts.
How about that?
That makes sense, because my brother got his purple belt not too long ago, and he stopped bothering me as much as when he was a blue belt. Because man, it felt like every other week he was coming with something different. But that's kind of ironic that's even what statistics and research says too, which is I lived it. I seen it.
Exactly.
So with that being said, you kind of talked about wrapping things and other things like that. So are there like taping rules and regulations for jiu-jitsu compared to other sports? Like, I know in the UFC you can kind of like have your ankles taped. I mean, obviously they get their hands taped for like fighting, but what's it like in the jiu-jitsu world when it comes to taping, bracing, and other things like that?
Yeah, there's no rules. Of course, no exposed metal or hard knee braces underneath the gi pant.
Sure.
Right. The referees will basically. So when you're going into a tournament, there's what we call a corral where you're all standing around trying to warm up, and then a ring coordinator comes to get you. You step on the scale first, weigh yourself. That ring corral person will check your gi for a proper length. It'll check it for any blood stains. They'll check your fingernails. They'll check for any skin lesions there.
Okay.
If you pass, then after you weighed in and you made weight, you go right to your ring. Let's say your ring number 9, and you wait there until your fight happens, which would be within 10 minutes. So there's a lot of checking. Before there was nothing, right? It was craziness.
Right.
I could imagine.
The Wild Wild West.
With huge abscesses on their face, Impetigo getting out there on the mat, like, no. As far as taping goes, most people now know that athletic trainers are going to be at these events, so they want their ankles taped. And if one's hurt, they would want to tape both because they don't want to show any weaknesses. Because if their ankle's taped on one and that looks like injured, I'm going to go for a foot lock right away. That's kind of like
That's
the
interesting.
bullshit.
Makes sense,
yeah,
right?
People do. Yeah. So people get double ankle weight, but there's no rule like there is in other stuff. Yeah. Not like baseball can't have any tape on the arm and NCAA and stuff. But, yeah, there's no rule. So people are starting to utilize the athletic trainers a lot more as far as taping is going. So it's starting to increase, I've seen. We never taped ankles before. Now we're starting to do it.
That makes sense. I think that makes sense. Like, just kind of evolves with the sport, and like it's the option is there, right? Like what you said before, if it wasn't covered, you didn't have someone who could properly tape an ankle. You probably have people who just wrap stuff on there and hope for the best. But now that you have the availability and the coverage, it kind of helps out with a little bit of everything.
Yeah, now within the last 3 years, there's been an advent of a new ankle submission that's been legalized. It's always been around in other dojos and kind of open mat MMA type of styles, but it's a thing called a heel hook, which causes a lower leg rotation, which in turn causes ACL, PCL tears, which in turn causes hip injuries, low back injuries, and up the kinetic chain. So we just took data on that. Well, it's been a couple of years. We took data. Me and a colleague took data on that. So I hope to publish that soon, just to show risk factors that this new technique allowed in jiu-jitsu. But with that, I'm starting to see a lot more knee injuries related to the heel hook. So we're getting a lot more knee taping going on in tournaments.
Oh, wow. Knee taping as well.
Yeah.
It's funny, where I work, we do a decent amount of knee taping. And I've always said, like, I feel like after I left, because I ended up working at my alma mater at Rowan, and it's like we tape a lot of knees here, but like outside of here, I feel like I didn't see many people who tape knees. And here we're having this conversation where knee taping is kind of evolving and kind of growing in the jiu-jitsu world, which is not what I expected at all.
No, totally.
And
I mean, finger taping is still number one because of gi grabbing.
Right.
Yeah, that makes a lot of sense.
You get a lot of, Herbert's nodes and, exotoses on your interphalanges a lot from grabbing the gi so many years that people tape their fingers up a lot.
Do you see many finger dislocations going along?
Yeah, we see a lot of. Yeah, that's way up there. Finger dislocations is big. We see a lot of that, and we'll relocate, and if they have more fights, they can continue to go. I really don't hold anybody back unless something's cervical or unless we're thinking there's a traumatic brain injury going on.
Oh, yeah.
Yeah, absolutely.
That changes everything.
Yeah, absolutely. So
it changes everything. Yeah. When it comes to cervical, and I get everything off the mat really fast. If it's ortho, if it's extremity ortho, I'll get them off the mat within a minute, right? It's a macro assessment on the mat. Is it located?
Yeah.
And do you have any range? Okay. If it's located and you have some range and maybe you tore your ACL, I'm still taking them off the mat within a minute, right? If you can't compete. If it's cervical, then the IBJJF has to shut down that mat. They don't like doing that, right? Because they like to run a really clean tournament. We're talking about running thousands of fighters through all these mats to make a time limit for them, because they rent the place. So
that makes sense.
I try to be as thorough as possible, as fast and efficient as possible, and that's how I teach my athletic training contractors.
Right.
But when it comes to cervical or head, no, we're there for as long as it takes.
Yeah.
Yeah.
You can't mess with that. The stakes are too high. Yeah.
Yeah. So
Yep.
So with that being said, you kind of led me right into my next question, which is from the students of like cervical injury trends that you kind of see, or like what's some common cervical stuff that you do see in your world and when you're covering these tournaments and other things like that.
It's so low. It's so low. I mean, luckily, because like I said, it's not judo. There's judo involved, but most people are not thrown. This is a ground game pretty quickly. Most people are not. They're doing wrestling takedowns, but there's not a lot of cervical injuries based on my data. There's new data out there, but still very small compared to NCAA wrestling or judo.
Right.
Just because you're not loading the cervical spine,
Yeah.
Definitely compared to any type of rugby or football. So it's very, very, very small. I can say, knock on wood, most events I don't have cervical injuries that are spine based. Maybe you'll have soft tissue injuries and stuff like that, but nothing that's going to warrant a further neurological exam or any type of transport.
So outside of the tournament aspect of jiu-jitsu, would you say the practicing and jiu-jitsu athletes, do you develop like a chronic cervical thing just because of all the different
Oh, it's great.
Cranking on the neck and different chokes and different things like that? Does that like kind of lead you down a path of potential chronic cervical things?
Yeah. So personal experience, I've had knee surgery, shoulder surgery. I tore my bicep last year.
Oh wow.
I've had a multitude of injuries. My neck always hurts. So yes, Now that data,
So yes.
we don't have any reporting. That's what sucks. NCAA has really good,
Right.
has high school reporting, college reporting, where we really can get really good epidemiological data. We just don't have it in jiu-jitsu,
Right.
And I took data on multiple events, for events. So here I
Right.
have a convenient sample, but imagine all the dojos reporting. What would that really tell us? You know what I
Right.
mean?
Yeah,
So,
absolutely. I
but
think that's
the biggest thing about jiu-jitsu is you can't fight. When you're practicing, you have to be water, and that's what's going to save you and keep you going for so many years. If you continue to fight, these people only last 6 months to a year, and they quit jiu-jitsu.
Right.
It's just too hard on their body.
right.
So, but we have a lot of youngsters now. I mean, the kid development in jiu-jitsu, I mean, people are being homeschooled,
Yeah.
and their kids are becoming these gold medal pan winners or world champions. It's just a medal. It's not
Seriously.
going anywhere, But these parents are crazy, just like soccer moms. I mean,
Right.
it's gotten to an absolute crazy level of soccer mom fury at the
Yeah.
dojos into these tournaments.
Yeah, I mean, my niece and nephew, once they turned 4, my brother got them into it, and it's crazy to think, but it's start them young, and you kind of develop that, and it's similar, young. I mean, they start wrestling at a young age too.
Yeah.
So it's
That's
definitely,
right, yeah.
it's definitely kind of very similar in that regard.
My son was in a tournament a couple weeks ago, and
I will not work for kids tournaments anymore, even as the owner of my company.
Oh,
I'm like,
yeah.
nope. I
Right.
will hire somebody to work that tournament.
I could imagine that. That's a whole different beast.
so yeah, my
It's
son
a
was in
beast.
a wrestling tournament a few weeks ago, and he was wrestling a pretty good kid, and I guess the kid took offense, thought he was doing something illegal. He certainly was not. He was just kind of chopping the elbow, like it's part of wrestling, right? And my son's up, and we're getting down to the last, I don't know, maybe 30 seconds of the match. And I wasn't there. I was on call, so I didn't get there until later. And they go out of bounds, and the kid hauls off and punches him. Yeah. And he got DQ'd immediately. The ref was like, "You're done. You're
Yeah,
out."
absolutely.
And then
Yeah.
the response on the parents, which, again, I wasn't there, was very frustrating. It wasn't like frustration or anger with their kid for like doing something that's way outside the lines.
Right.
It was they were mad at the ref, and
Right.
like that kid is doing, like, they're just wrestling, like it's within the lines, like I don't know. So I understand what you're saying, the fear of the soccer
The
mom, or
emotion.
the parents, the emotion, and especially in a sport like that, a high intensity sport.
Combat.
Combat
Emotion
sports,
and
emotions,
combat for a kid.
they just go through the roof.
Yeah.
And I've seen a lot of, when it comes to kids tournaments,
Uh-huh.
I may see injuries, orthopedic injuries, but I'll see a lot of hyperventilation, a lot of anxiety, a lot of crying, because it's just the pressure.
Right.
The pressure is immense.
Big time.
You'll calm a kid down from an anxiety or panic attack, and then mom, dad, or coach walks over and they spike again. It's like there's the
The mental
issue,
health
And
aspect
it's
of
the-
it, right?
Yeah.
I think
It really
it's
is.
also the one-on-one component of
Yeah.
it, right? Like they feel like they're on stage and they feel like they're the one that's insulted. But I guess on the flip side of that, there's that, like, there's also that joy in that particular moment where, like, you feel like you've done this on your own, you've won, you've accomplished, like the highs and the lows, man, in sports like that are pretty extreme.
Yeah.
Agree.
I got a question for you. I'm kind of curious now. Now you're at the tournament, but then the aftercare, and you're starting to treat these guys. They have some injuries, and you're treating your role as athletic trainer. What are your thoughts on both BFR as well as dry needling?
Yeah, I don't get any aftercare because we're triage. We're basically glorified EMTs. We're taking care of the mat and everything right there. So only if somebody has to report to the hospital where I follow up.
Okay.
As far as personally with my own dojo,
Right.
and you're talking about BFR, which I love. I think BFR is a great way to keep muscle mass on as you get older.
Sure.
Right.
So to me, it's a no-brainer. You have a lot of people who get injured and they can't lift load anymore, or they're hesitant to lift load. I mean, you can slap on BFR at certain percentages of limb inclusion pressure and have really good results. I mean, the research is very strong in BFR.
So we've had some other guests on and talking about BFR, but just for people that are listening for the first time, what exactly is it, and sort of the logic behind it? How does that help put on strength or put on muscle for just like you're saying?
Yeah. So blood flow restriction is a way to turn somebody into an anabolic state really, really fast. So it shuts off venous return. So you still have some arterial flow to a limb, but it shuts off return. And when you shut off return, you cause a lot of metabolic changes in the muscle, which will increase growth hormone systemically. It'll tap into white fibers and muscle building fibers instead of oxidative fibers. So we have the chance to build muscle in a faster and more efficient way than getting underneath the bar. So if somebody can't get underneath the bar and do heavy loads or want to lift heavy loads, we have a chance to cause this hypoxic environment in the tissues by putting a cuff on their arm, basically a blood pressure cuff. And you pump it up to a certain, what we call limb occlusion pressure. And we can cause this hypoxic environment, which has a cascade of benefits of anabolic changes. I mean, it's really crazy, Doc. And, you know, I've been teaching BFR for a company called Smart Tools for a while. Of course, I'm biased, but I've seen I've read the research. I've done it myself. I've done it with other patients of mine, and I've had really great results with it. And I just think it's a no-brainer. For my mom, who's 85 years old, BFR, you know? She needs to keep muscle mass on and keep skeletal tissue healthy, and bone mass. I mean, there was no negative effects using BFR, in my opinion.
So
unless you have a red flag.
I think for us in like the orthopedic world, as you're recovering from an injury, it's a great way to be able to load the muscles without loading the joint or whatever it is you're protecting. And like, and it's just like you said, you know, you reduce blood flow, you reduce oxygen, you reduce, and it's almost like they're getting a workout without working nearly as hard or like, you know, putting a lot of stress across that particular joint. And, you know, for us, when like, you know, and I think there are advantages to loading the bone and loading the joint for like you know, bone response to stress, right? Like, so when you're younger, if you have the ability to work out, that's what you do. You work out because you want to load the joint and you want to load the bone. You want to have it, and you're not just focusing on just on the muscle. But in a scenario, like you said, an older athlete or older person, or in our scenario, recovering from an injury, it's a great way to get some of those benefits of that workout without actually stressing or ruining the repair or ruining the joint and whatnot. It's pretty. When I remember first hearing about it, being like, I can't see how that would work, but it does. It seems to work very, very well.
Yeah, I mean, access to type 2 fibers. People don't go there. We don't go there with rubber bands. You know, any type of athletic training, physical therapies we do, we never get to type 2 fibers. We really don't. You know, you have to be in the gym. And the research still suggests that high intensity training is still number one over BFR. So I totally support what you're saying. If you can load and you're healthy, go for it. But if you can't, then here's, I mean, especially, you know, post-op. I mean, as a doc, you're post-op. You know, you got to get that on. I'd probably wait like maybe 2 weeks when the sutures are out, then hit it. You know?
For sure.
So I think we kind of touched on a bunch of stuff. I mean, I think this conversation's gone all over the place, and I think it's been pretty insightful for your world of what you do as an athletic trainer for jiu-jitsu, the world of jiu-jitsu as itself, and different things like that. So I guess my question would be, how would, like, you know, an athletic trainer get involved in your company, or like when you guys do different things across the nation? Like, how would someone either get involved, reach out to you, or like kind of get the coverage you needed as, you know, different tournaments across the country? How
does it help you, and how could somebody else who wants to be involved get a hold of you and become part of it?
They can find us. They can find us on social media at Black Belt Sports Medicine on Instagram. They can email us at blackbeltsportsmedicine@gmail.com. They can find us on Facebook at Black Belt.
Perfect.
So we're out there social media. On Instagram, I'm at Dr. Kreiswirth. Maybe put that in the show notes. But Black Belt Sports Medicine through Instagram is fine. And we develop a state-by-state list of people that want to work for us. We pay a decent hourly rate that's competitive with the hourly rate for the NATA. And we provide food at the tournaments. So we want to make sure that you have a good experience. I don't try to throw anybody into the fire. I'll talk to them. I'll Zoom call with them. I'll explain it to them. I'll teach them what they should do and how to recognize injuries. And then we get them out there.
That's pretty awesome. Yeah. And what a great idea. What a good model for a business.
Thank you.
Really great idea.
Thanks. And it's something I love to do. I like to get, as an athletic trainer, I like to get involved in sports that I love, which is indoor cycling, outdoor cycling, racing, and jiu-jitsu.
I was going to say, man, like, what a perfect, like colliding of different worlds. The way that you've carved it out. Like, you're an athletic trainer. You like the combat sports. You like jiu-jitsu, and now you've built this business on those two individual things. You get to go and compete and do your job exactly at the same time. Like that, I don't know how you pulled that off, but that's amazing.
Well, it took years.
Right,
it
for
took
sure.
a lot of years. Rome wasn't built in a day, right? You know what I mean? It took
That's
a little
right.
bit of time. So,
That's right. I've worked for plenty of people.
I'm sure. So before we go ahead and close out here, is there anything else that you want to talk about, cover, or let people know about what you do, or anything like that we might have didn't cover tonight?
Shout out to my assistant Shelby Daly for reaching out to Sports Medicine on Tap.
Yep.
Really cool. I love you guys.
Thank you.
She's in Philadelphia. You're in Philadelphia.
Love it.
So that's really cool. So I really appreciate getting on with you guys, and just it's great to have an orthopedic doctor on a call too. Normally I do podcasts, but typically they're with PTs or other ATs. So having a doc on here is really cool. That's new and very novel.
Yeah.
So I appreciate you guys. So thanks so much for having me.
Thanks for reaching out and thanks for coming on, man.
Yep. All right. So again, folks, before we go ahead and close out our tab, we just want to give a quick shout out to our sponsors, the Energy Lab, the region's premier sports performance center and destination, Neck of the Woods Brewing Company in here, Pittman, New Jersey. Just a couple dates and things for Neck of the Woods. They have Sourfest coming up May 18th, 2024.
Can't wait.
And then Neck of the Woods is also partnering with the local Veterans Multi-Service Center to on-take Operation Care Package, and they're looking for donations for non-perishable food items, toiletries, gently used clothing, new underwear and socks, going anywhere from March 1st to the 23rd. So come to Neck of the Woods on Saturday, March 23rd from 12 to 4 to meet the hardworking people of the VMC as well. And lastly, we're going to give a quick shout out to Timber Reel Productions, helping us produce this show and get everything out to our listeners. And we thank everybody. We'll see you next time.